Miss Kim. How are you doing today?
I'm good, thank you.
That's great. From what I understand, you have some concerns.
Yes, in my culture it's very important that there's no drafts or cold air, and the doors are always opening and closing as people are coming in the room, and the vents are very big, and I'm pretty sure that's what caused my hemorrhage yesterday. And also, because it's important in my culture that once you've given birth, you're always eating warm foods, and there's specific types of foods to eat, and I'm just not getting that here.
Okay. Well, first of all, if you're cold, I could get you a warm blanket. Maybe that will help.
Sure, I'll try that.
And I can assure you postpartum hemorrhage is not caused by any cold air or drafts. But if you prefer, I could sign you up for a private room that will help with the door opening and closing and drafts. And we could also advise the staff not to keep the door open so much.
Okay.
And we could ask your family to bring you hot food that you prefer. Maybe that will help. And additionally, we can talk to the nutritionist and dietitian to try to accommodate your preferences. Is that okay?
Yep, sounds good.
Okay, I'll go get you a warm blanket.
Thank you. Hey.
My name is Mike and I'm going to be your nurse today.
Okay.
So I read in your chart that you gave vaginal birth to a baby girl 2 days ago.
Yeah, I did, but I was bleeding a lot, so I had to stay.
Yeah, that sometimes happens when the vessels in the uterine don't contract enough to stop the bleeding. Why don't I do a postpartum assessment to see how you're feeling now?
Okay.
So everything is looking good, and it seems that your bleeding has slowed down and your uterus is nice and firm.
Do I want my uterus to be firm?
Yes, because when it's contracted, and that means that the blood vessels are closed. If check in yourself and you feel that it's not firm, just massage it a little bit.
Oh, okay.
So how are you feeling now?
I'm okay, just anxious. You know how it is.
What's making you feel anxious?
Well, I want to be home taking care of my family. My husband's there with them now, but I think he's kind of overwhelmed.
Okay. Do you have any family members that you can call in to help you out and see how you're doing?
Well, there's my parents, but they live an hour away.
How about some friends if you have any? We can call them.
There's my neighbors. They might be able to help.
Okay, why don't we take you to the nursing station and maybe you can call your friends to help you and your husband?
That'd be great, thanks.
Okay, see how are you doing? That's it.
Good, excited to go home.
Okay, your husband's here to come get you and Dr. has prescribed some medication. So when you get home, just call us if you have any pain or some dizziness. Do you have any questions for me at the moment?
No, I'm good.
Okay, well, it was very nice working with you and best of luck.
Thanks.
You're welcome.
Roy's model assesses the patient on 2 different levels. The first level assesses the patient's behavior in 4 different modes: the physiologic mode, self-concept mode, interdependence mode, and role function mode. The second level of assessment deals with stimuli, and the 3 types of stimuli are focal, contextual, and residual. From these assessments, the nurse determines whether or not the patient is adapting effectively and helps promote adaptation in the areas that the patient isn't adapting effectively. For example, an assessment in the interdependence mode. Mrs. Smith, I understand your husband works full-time and you have 2 children at home that you usually care for.
That's true, yes.
Is there anyone you have a close relationship to that can help take care of the kids while your husband is at work?
Or I could get my neighbor to watch them during the day while my husband is at work, and he would pick them up in the evening maybe.
Okay, perfect. Let me know how that plan works out, and if it doesn't work out, we'll figure out something else, and I'll get social work up to talk to you. Do you think that would help?
Alright, thank you very much.
Okay.
Yeah, thanks.
Hi, Ms. Kumar. My name's Alan. I'll be the nurse working with you today, taking care of you, right?
Hi.
If you have any questions at all, do let me know. I'll answer them as best as I can.
Okay.
How are you feeling?
I'm okay. Anxious though. Been here for the past 2 days. Would really like to go home.
And I understand it must be a very difficult situation, having to stay longer than expected. But we want to make sure that your baby and yourself are okay before you go home.
Okay.
Just wondering if you're in any pain right now.
Yes, a little. About a 5 out of 10.
Okay. Can you describe it for me?
It's burning down there.
Burning down there. Okay. Well, I can get you an ice pack, and I can also get you something for your pain. Would you like that?
It would be nice.
Okay, and I'll do that for you, right?
Okay. I really appreciate you helping me so much. I've never heard a nurse that is taking care of me so much. I appreciate you. Thank you.
Thank you. Thank you. We're here to look after you.
Okay.
So before I continue, I'd like to get the pain medications and then continue with your assessment.
Okay, that would be nice.
All right?
Thank you.
You stop
Cut.
it.